All right, welcome back to ABA exam review and the continuation of our BCBA 6th edition mock exam series, where we're going through another set of questions on a specific task list, item, or topic and going through them together. A couple of commenters requested ethics questions, so today we will cover ethics. If you have something in general or in particular or a specific task list item, whatever it may be that you'd like us to cover in future videos, be sure to comment below and we will get to those as they come in. Check out behavioranalyststudy.com for all of our study materials, including our combo pack. When you pass your exam, be sure to let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. A behavior analyst is asked by a school administrator who is not a behavior analyst to implement a timeout procedure for a student's disruptive behavior without conducting a functional assessment because we need something in place immediately. The analyst explains that ethically, they must first conduct an assessment to ensure the intervention is appropriate and likely to benefit the student. What is true about this ethical scenario? Now, starting off with a straightforward, what is true about this ethical scenario? And in this case, you want to think as black and white about our task list and our ethical code as possible. Real life, we know things aren't as easy as or clear as on an exam, but on an exam, you want to go by the ethics code as much as possible. So we have an analyst who's asked by a school administrator to implement a procedure, but they have not done any assessment yet. They want something in place immediately. The analyst correctly says, well, we need an assessment to ensure intervention is appropriate. So what issues is the analyst running into? Well, when you're collaborating with other professionals, especially let's say in a different setting that you don't necessarily control, you still need to abide by our ethics code. But if the other person is not a behavior analyst or a BCBA or RBT or whatever, they aren't bound by our ethics code. So in this case, this administrator who's not a behavior analyst, they don't have to follow our code. So you're in a tough spot. But even though you have to be as ethical as possible, you still have to support the team. You can't just not support other team members. What is true in this scenario? A, the administrator is in the wrong because they are violating the ethical code. Well, again, the administrator does not abide by our ethical code. They're not an analyst. B, the analyst is correct that an assessment must be completed. Technically, no, right? Because in this case, if the administrator is making the decision, then they don't have to perform an assessment because of our ethics code. C, the analyst may have to support the team if they go forward with the timeout procedure. Yes, C is the correct answer. Depending on who's making the final call, an assessment may not have to be completed. Is it the most ethical? Sure. Does it have to be done? Not necessarily in this case. So, what is true is the analyst may have to support the team if they go forward with a timeout procedure. How can they support them? Take data, train, give feedback. If it works, it works. If it doesn't, be there to make the adjustment through support. Dr. Chin discovers that a colleague has been billing insurance companies for supervision hours that never occurred. Dr. Chin is concerned about reporting the colleague because they work at the same clinic and fear retaliation. However, Dr. Chin understands that failing to report could result in harm. Which risk to the profession is most likely if this unethical billing practice continues unreported? One key idea with our ethics code is that we try our best to avoid damaging or harming ABA as a profession. ABA has come a long way, and there's still a lot of work to do as far as public perception goes. So we want to eliminate risking any sort of harm or negative ideas about our profession. So we have a situation where Dr. Chin knows a colleague is billing for hours that don't exist, obviously very unethical and illegal. Dr. Chin is concerned because they work at the same clinic, and what if they lose their job? What if they're also fired? Very normal concerns. But Dr. Chin knows that failing to report could result in harm. Now, what risk is there? What is most likely if the unethical practice continues? A, decreased trust and behavior analyst. Sure, right? There is absolutely a decreased trust in behavior analysts. If we're billing unethically, insurance stops trusting us, parents stop trusting us. Not a good look. B, the colleague may lose their certification, but their profession will remain unaffected. Well, I'll give you a real life example. 4 or 5 years ago, it was a big news story where I lived. There was a clinic that did ABA, and it was a giant story in the news about unethical billing. I don't think this is just going to be swept under the rug. C, insurance companies will stop covering ABA services for all providers. Unlikely, right? One insurance company doing this isn't going to ruin it for everybody, but it's not going to help. D, other analysts at the clinic will be held legally responsible for the colleague's actions. It's not completely likely, but if Dr. Chen knows, maybe she's possibly at fault. But all the analysts are not legally responsible for this colleague's actions as a whole. So most likely, it's just a decreased trust in behavior analysts. A behavior analyst posts on their business Instagram account. Just had an amazing session. My client with autism finally said his first word after 6 months of intensive ABA therapy. This is why I love what I do. Hashtag ABA works. Hashtag autism therapy. Hashtag BCBA life. What is the primary ethical concern with this post? Now, what is the rule about social media posting? We can't post anything, even with consent, to our personal account. Business account, we need consent forms and to follow all the protocol in order to post something to the account. Now, in this case, right, we're looking at the ethical concern. So we don't know about consent and all that. We're just based on this information. What's the concern here? My client with autism said their first word after 6 months of ABA therapy. What is the analyst possibly doing? Well, they're revealing information about this client. Now, why is that a problem? Well, any personal information about a client should never be revealed, not only because of ethics, but again, we have laws and regulations like HIPAA that protect against all privacy. So, what's the primary ethical concern here? A, the analyst may have violated confidentiality by sharing identifiable client information on social media. Not talking after 6 months, going to ABA and learning to talk is pretty identifiable, right? It isn't uncommon, right? But it isn't exactly happening all the time, right? So there is some identifiable information here. B, the analyst may be misrepresenting service outcomes by implying ABA is always effective for language development. Well, I don't think the analyst was implying that ABA is always going to lead to this type of change. They were just excited about their client. They just revealed too much. C, the analyst is inappropriately using social media for business purposes. Business accounts with consent can post about clients, right? There's rules around advertising and testimonials, but with consent, it's okay. D, the analyst may be making inaccurate public statements. It doesn't appear that they're making anything inaccurate. If that's what happened, that's what happened. However, it's just too much information about this particular client, and they may have violated confidentiality by sharing this information. John, a behavior analyst, has been working with a 10-year-old client for 18 months. The client has made excellent progress, meeting all treatment goals for the past 3 months. The parent wants to continue services just in case, but John believes continued intensive services are no longer clinically necessary. What should John do? That's some sort of typo there. So, what should John do here? He's a behavior analyst. He's been working with his client for 18 months, and the client has made excellent progress, met all goals. Now, at the beginning or the onset of treatment, you already need to have an idea of transition, right? What are your goals? What are you trying to accomplish? Once you've accomplished your goals, you need to figure out a way to transition your client. We're not supposed to be there forever. It's not the point of our job. And especially if all treatment goals are completed and it's been a while and the BCBA believes they're no longer clinically necessary. If you believe they're no longer clinically necessary, parents are always going to want that. Well, not always, but they're a lot of times going to want that extra help no matter what. If you don't think it's necessary, go spend your time doing something else. So what should John do? A, continue services as requested since the parents are paying and want to maintain progress. Parents may be paying, insurance may be paying. Regardless, we can't just go by it because they're the ones providing or letting us do services. B, discontinue services immediately since all goals have been met. Do we ever stop suddenly? No, we need to transition and fade out. C, recommend fading services or transitioning out of services. Yes, right? Let's start fading services out. Do we stop immediately? No, but we can dial back hours and programs and that sort of thing. D, transfer the case to another analyst who's willing to continue intensive services and may have additional ideas. We don't want to just start passing this client around because we've done all we can. Maybe someone else can do something other than us. That's just almost starting over. If John has achieved all those goals and believes nothing else is necessary, then it's time to transition. And it can be a difficult choice and a difficult thing, but it has to be done. A behavior analyst who strongly believes in natural environment teaching approaches is assigned a case where the funding source requires a minimum of 20 hours per week of structured tabletop discrete trial training to authorize payment. The analyst personally disagrees with the intensity of DTT and believes it's not in the child's best interest. What should the analyst do first? All right, a mouthful in this question. You saw me kind of stumbling a little bit. It's going to happen. A lot of questions, lots to think about. That's why we take our time and we attack the question. I'm not rushing to the answer choices, just breathing and taking my time. Now, question wants to know, what should the analyst do first? We know the analyst believes in natural environment teaching, but they're assigned a case where they have to work a minimum of 20 hours per week in DTT. Now, the analyst personally disagrees with this intensity of DTT, believes it's not in the child's best interest. However, that's what funding requires. So, what should the analyst do first? We're talking first move. A, examine personal bias and consult with colleagues to determine if bias is interfering with objective clinical decision making. Part of the new ethics code talks a lot about bias and examining our own biases. DTT and NET, natural training, are both empirical strategies, right? Maybe this analyst is a little bit biased from learning history, their own personal experiences with ABA, whatever it may be. But they may be biased, and examining those biases is important and part of the ethical code. B, decline the case due to personal bias against intensive DTT. Well, before they do that, maybe they can grow and learn from this. Maybe there's an opportunity. C, implement DTT as required by the funding source since it's a legal requirement for payment. That is true, but why doesn't the analyst try to learn from this? D, implement DTT but supplement with NET without billing for those hours. Definitely not. Now we're extremely unethical and doing something illegal, and we absolutely should avoid that. New ethics code talks about bias. We've got to examine our biases. We've got to stay or remain growing and learning and trying to be as unbiased as possible when administering services. Thanks for watching. Be sure to check out the rest of our BCBA videos. If you have a topic you'd like to cover or us to cover in the mock exam, let me know and we will go through them as they come in. Work hard, study hard. We'll see you soon.